Hello, guys and girls. The program you are about to hear will be both fun and educational, but it is not a substitute for medical advice. Although we are doctors, we are not your doctors. Hello, and welcome to Travel Medicine. As always, I'm your friendly neighborhood internal medicine doc, Dr. J.
Heyo, Dr. Santhosh here, pediatric infectious disease doc and sometime researcher.
Hey, I'm not working tonight, so in the ER, so your friendly ER doc is hanging out with his buddies.
That would, of
Wait.
course, be Dr. Ward, our
Yeah,
medical member.
Dr. Ward.
you want to tell him your name?
Came off a night shift. Not enough sleep. It's me, Dr. Ward.
Hooray for hospitals, full of physicians so methodical. They're treating all of your various diseases, heartaches to sneezes, and that's what we'll cover today.
Hooray for parody law!
I
Yeah.
feel like sometimes with our parodies, it's like the CIA trace in movies where they're like, almost, oh, he stopped in just the amount of seconds where we can't sue.
Why are you singing the musical Hospitals to the background, or I should say tune Hollywood from I can't remember what musical?
Well, I was thinking about shows in general, and there's an actual medical Broadway show that someone is in the midst of creating that I saw
What?
on TikTok. And I wish I could send you a link to it, but I'm old and don't know how to find it again.
Oh
So
no.
it starts off with somebody at an operating table who bursts into song, and if that's not just how I picture my everyday going, I wouldn't even know what else to say to you. But it's not the first time that this has occurred. On the evening of October 10th, 1947, a medical musical opened that was the hottest ticket in town, written by none other than Rodgers and Hammerstein. Did you
Oh
know
wow.
that Rodgers and Hammerstein wrote a medical musical?
No, they didn't.
I thought Scrubs was the first time that
Yeah,
medical
there.
drama
That
came
that
on,
I thought we were
came
gonna
on TV.
highlight. Yeah, I thought we were gonna highlight your favorite, Josh. The Scrubs musical episode.
They made a musical episode?
Oh,
Oh,
Oh
Lord.
my gosh, I am out of it.
Rodgers and Hammerstein wrote a. Now, granted, the purpose of it was less about medicine specifically and more about an everyman allegory with the protagonist being a doctor, as
Oh.
every man is,
like 4% of us are sure.
right?
Okay, but yeah.
So the title of this 1947 production was Allegro. It was it set a lot of records, but not all of them were good. In
Oh,
fact, in
okay.
fact, this was only the fourth show put together by Rodgers and Hammerstein, and it it sold huge amounts of opening tickets, making $750,000 in 1940s.
Whoa. Okay.
But critics hated it.
Oh no.
It got so badly review bombed that they just kind of wiped it from society's memory, and it's it's essentially a Hallmark movie.
A Hallmark movie is usually a big city doctor, lawyer person goes to a small town and finds out that the big city life,
Yeah.
working 80 hours a week, is BS, and you fall in love with the local small town, whatever gender.
Okay,
Sure.
all right. I'm going to describe the plot of
Is
this
that what happens
show.
here?
I'm going to describe the plot of this show, Ward, and you tell me if you think it would fit in on the Hallmark Channel. All right? And just
Okay.
for context, Rogers, his brother, and father both practiced medicine, and Hammerstein had wanted to write a medical themed show. So,
Oh, okay. So this was
so Joe, it follows a young physician from birth to burnout or midlife
whoa.
crisis
All right.
at age 35. That's the midlife crisis.
Yeah.
So, Joe A young physician is born. You watch him grow up, go to prom, marry his high school sweetheart Jenny, and then the dramatic conflict is Jenny wants Joe to abandon the idea of joining his father's small town practice and instead move to the big city for a better life and more lucrative living.
Oh, okay.
Convinced that her son is marrying the wrong woman, Joe's deeply disappointed mother dies of a heart attack.
Whoa.
Yeah,
Act
that does
1.
sound.
Act 1 close.
That is very
Okay.
Hallmarky.
Act
Okay,
2.
okay. A dead close relative is definitely a Hallmark thing.
Well, no,
I
this
will agree
is
with you there.
it's feeling a little bit Bollywood actually right
And to go to the
now.
big city. Okay. Then, amid the glittering lights and fascinating people of the big city,
Yeah.
Joe and Jenny attend a whirlwind of parties and ribbon cuttings, soliciting donors to fund new patient pavilions at the hospital. Joe
Okay.
makes a mint giving vitamin injections to the worried and wealthy well, but Jenny feels neglected and occupies her time by having an affair with the chairman of the hospital trustee board.
Dun dun dun.
Of course, Jenny's found out. Joe ends up breaking up with her and resigns from the hospital to go back to the small town. The trustee explains Joe's resignation by telling them Joe is sick. Joe overhears the remark and says, "Tell them I'm just getting well." And the stage direction then says that he walks away into the sunlight, joined by his adoring nurse Emily and his best friend Charlie Townsend.
Oh, okay.
I have some issues with the plot, but I can see why the critics,
Oh,
yeah, had an
oh,
issue
the
with it.
critics. So at the time, one of the New Yorker's most acerbic critics called it not only a shocking disappointment, but then ridiculed all of Joe's patients as suffering from alcoholism, nymphomania, locomotor ataxia, and echolalia, which honestly is pretty impressive for a critic to be, naming that many various conditions.
Wow.
Wait,
Yeah,
why?
absolutely.
Okay, wait. So, I mean, at that part, I don't agree with. So, why shame? Why shame? Some of these are not real medical conditions, I don't think. But why shame medical conditions?
Well, he said that Joe's wealthy patients didn't have real diseases. They were sex crazed, alcoholics,
Oh
uh,
no! Oh no!
echo, echolalia, meaning compulsive repetition of idiotic lines, and the
That one I agree with.
locomotor ataxia, as seen in syphilis, from their incomplete, uncoordinated ability to shamble about the stage. So he used real medical
Whoa.
conditions to describe
Okay.
terrible performances.
Oh no,
Yeah.
man! At the same time, shaming all these people with echolalia and locomotor ataxia.
Yeah, because those are, I mean, they're pretty bad. He's describing symptoms, not actual diseases, but those types of symptoms portend some pretty scary, like degenerative or frightening kind of things that are going on with the brain. Um,
So, just a fun little footnote to this is
yeah.
that one of the interns that Oscar Hammerstein employed was a 17-year-old kid who was a gopher during the production of Allegro, this stage play that completely bombed. And the name of that intern
Yeah.
was Stephen Sondheim.
Oh, okay. All right. That's pretty good. I like that.
Well, let me ask you this. So this relates to Scrubs as well. I think they think doctors' lives are way more glamorous and wealthy than they actually are. Like, when we were young
Yeah.
doctors, did we go to all those ribbon cuttings and.
Well, so it depends on what kind of doctor you want to be, right? Because going to the big city doesn't mean that you all of a sudden change your population, right? You can take care of the same sorts of people, or you can choose if you want to. And it takes a lot of energy, but just like you can climb the social ladder in any other profession, you can do the same thing with medicine, but you have to try. Like, you don't fall into those practices.
I don't have time to do most of that stuff. And and I mean, I'm sorry, general public. My hospital
No,
was not
no.
nearly as how should I put this, traditionally attractive or as
Yeah.
Scrubs.
Well, and I don't think it changed too much, from the 50s to now, except that, the amount of money flowing through the system is greatly changed. But
Ward, if you're not attending hospital galas, are you even practicing medicine?
stop shaming Dr. Ward. You stop it.
Now,
I,
disease has always been a part of the theater, sometimes as an actor, sometimes as a member of the crew. So
yeah.
let's talk about some examples first on stage
Mhm.
before we go behind to where I know you liked to work in production.
I wanted to just quickly back to Allegro. I'm a little surprised, the ribbon cuttings and high society stuff aside. I'm a little surprised at how topical all of this stuff still is. Having populations of, worried wealthy well and doctors who give these, stupid, injections and stuff or, vitamin injections and things. That's still around, and
Sometimes in that literal form.
yeah,
But
yeah,
let's
exactly.
let's talk
Anyway.
about disease on in front of house, front stage, which is where Ward and I like to reside.
Oh yeah.
Uh, of course, one of the most famous examples I think we could name of disease represented in Broadway is Rent. Uh,
Mm.
and did you know the 1996 musical Rent is based on an 1896 opera La Boheme?
That I did know.
I
They that was that they talked about that because it is essentially it's about a group of marginalized people living a quote unquote bohemian life.
Yeah, I did learn about it only because I'm gonna sound way more posh than I actually am. But I got to do a school trip when I was a kid, and one of the musicals we saw was Rent, and we got to do a little mini as a high school theater nerd outing. We got to have a quick Q&A with the folks. The director had actually passed away, not, or the composer, I guess, that who created it had actually passed away, I think, by that time from AIDS. But we got to ask questions and they gave us a little bit of the history. Yeah.
So the difference is, as you noted, Ward, it's about a group of marginalized people, in both cases artists, struggling with disease, and it happens to be the disease of the time. So in La Boheme, it's tuberculosis, and
Mm.
in Rent, it's HIV. The disease plays a fairly large role when two of the main characters have a romantic relationship, fight for months, and separate only to be brought back together when one of them falls ill with said disease. Rent is actually the happier ending of those
Oh God.
outcomes. So,
Wait, how was that less
Yeah.
happy in La Boheme? I'm curious.
well,
Do
spoiler
they
alert
do they
for
all
a
get
Sure.
it?
Yeah.
um,
Okay,
the
so La
friends
Boheme,
the
yeah.
friends are brought back together by Mimi's failing health in La Boheme, and she dies, and one or two others begin to get sick in La Boheme. While in Rent, the sound of Roger's voice is enough to keep her alive.
Oh,
Wow.
wow.
Okay, yeah,
So Rent is
because
the uplifting version.
I remember there is one because the character Angel does pass away in the middle of Rent. But yeah, one of the others is kind of revived, by, please stay alive. And then, it ends before anybody else can die. But
Well, you know what? Medically speaking, quite plausible that Mimi is still with us if she contracted HIV in the mid 90s
yes, if she,
because
well,
treatment really improved.
Ward, if she was able to get help, that's the big one.
Let's talk about living with HIV in the 90s versus living with tuberculosis in the 1800s or 1890s.
Just quick aside, Josh, tuberculosis not gone, not even a little.
But the treatments and the life
Yes.
expectancy of people with it have significantly changed since the late 1800s.
That's fair. Yes, as long as we talk about access. But right now, folks who are in any kind of like poverty situation and countries that don't disperse these medications properly or that kind of a thing, we still have lots of death from TB. So it's maybe not as prominent as it once was, but it's definitely still around.
HIV is still around too. But
And HIV is still
yes.
around. Absolutely. Yeah.
But in both cases, you gloomy gusses, we now have a number of medications
Yeah.
that do allow people to not just survive, but in some cases thrive even with these conditions that are chronic.
So Dr. Santhosh mentioned that, not to sound posh, that they went to the musical Rent. I remember in the mid '90s. You guys remember the
Yeah.
'90s? It was like, white flight, urban decay,
Yeah,
AIDS.
yeah.
That was all
Abs
captured in Rent, and it was
yes.
definitely on the grittier side of musicals. I can't think of another one from that era that was that gritty. Yeah, instead of escapism, that was one of that was one of the musicals where they wanted to bring the message to you.
Yeah. It
So,
was tough to watch.
so if I had to ask you guys to name some of your other memorable medical performances on Broadway, what else could you think of?
What about that barber who made people into pies, where Angela
S-
Lansbury played
Sweeney Todd?
Sweeney
Sweeney
Todd,
Todd? Sweeney
sure.
Todd.
And
Original
and
surgeons were barbers.
Yeah.
surgeons were barbers. And what sort of diseases would you be subject to if you consumed human pies?
Oh boy, it depends on the human.
I mean, if it wasn't well cooked,
Sure, that's the issue.
yeah, yeah. If it was,
Poorly
So,
prepared corpse flesh.
so human sashimi would probably give you any and every bloodborne illness, and
yeah,
hepatitis, syphilis, probably. Well, it depends on the type.
yeah,
Yeah,
and
yeah.
all of the bacteria that's on the skin. So Staph aureus, would cause food poisoning, and invasive streptococci.
Oh, salmonella! You can't use you can't use raw human forks
Got
with the cooked
right,
forks.
yes,
Yeah.
because it's well, yeah, especially if you gave them, yeah, like if you use the intestines.
So there you have it, folks. Sweeney Todd, one of my personal favorite shows, no longer believable because the hygiene would have killed people long before.
If the victims had any kind of prion disease, and use the brain in there, you could pass on, like Mad Cow or Creutzfeldt Jacobs. That would be fun. Or like, what was the one that the Kuru, I think, was the cannibals
Yeah, yeah. So
in Papua New Guinea? Yeah.
so a lot of diseases could be obtained from mass consumption. All right, what are some other famous medical moments in Broadway?
Let's see. Mental health, Sunset Boulevard. When she's like going crazy, I think they take her to an asylum at the end, don't they? Next to Normal, is that what it's called?
Yeah. So
Oh, gotcha.
if you're thinking about mental health musicals, 2008's Next to Normal is brought to mind about a woman who struggles with bipolar disorder. And Santosh, I believe you formed an attachment to one of the songs right off the bat
Yeah.
called
Yeah. So this is Who's Crazy slash My Psychopharmacologist and I. And I guess it's a back and forth, maybe a trio. I think there's a husband talking about losing his wife to mental health. There's the wife who is, struggling with bipolar disorder, and then her doctor, the psychopharmacologist. Very, I think, in a mean spirited way, talking, about the patient and really giving a bad impression of, a psychiatrist or a
Oh
psychologist.
no, are they shaming
Um,
medical conditions?
well, it's kind of highlighting the extreme cases. So a little bit of an aside, psychopharmacology works a lot of the time. Okay, many people, it's a single antidepressant or something like that. It works. People get better. They go to therapy. But yeah, on the edge or extreme cases, you have to try a lot of different medications and combinations and this kind of a thing. And so this one highlights one of those extreme cases where she's going through multiple medications and
singing about them, which
then
is
singing
even
about it.
more impressive.
Yeah, and a rather, portrayed as a cold, detached psychiatrist or psychopharmacologist who is updating us on her progress.
I'm sorry, and just by hearing this song title, My Psychopharmacologist and I, is this a comedy? Like a
Oh no,
No,
no.
it's this one is dark. It's
okay, so it's
really
not a parody comedy.
So
no.
imagine, Ward, if you had to sing your notes as you wrote them down.
Oh God, that's
Yeah,
very dark.
can I play a little bit? Is it okay,
Yeah,
or are we
by all
gonna?
means.
Who's crazy? A husband or wife who's crazy to live their whole life.
So this is the husband.
Believing that somehow things aren't as bizarre as they are. Who's crazy? The one who can't cope, or maybe the one who still hope. The one who sees doctors, or the one who just waits in the car.
So I'll fade a little bit there.
It sounds like almost every other musical I want song
Well,
that I hear.
it's a little bit. Here we go.
My psychopharmacologist.
Let's.
One who can drive.
Okay, here's
Round blue ones with food, but not with the oblong white ones. The white ones with the round yellow ones, but not the trapezoidal green ones. Split the green ones into thirds with a tiny chisel. Use a mortar and pestle to
My
grind them.
psychopharmacologist and I. It's like an odd romance, intense and very intimate. We do our dance. My psych.
So you hear at the very beginning, the husband is lamenting that, I know that's the person who's living with bipolar, but I feel like I'm, getting impacted by it.
Which is very relatable to almost
very
any caregiver.
Yes, yeah, you can get caregiver fatigue. The woman, the I can't remember the character's name, but she breaks in and talks about it, and then in the background, word just like you heard, that's that voice dictating basically. So in this case it is a pharmacist, but you'll see as they go along it's the person's actually prescribing, so it's probably more like psychiatrist and I, but it doesn't have the same like rhythm of my psychopharmacologist and
I
I.
was gonna say they're not allowed to prescribe
Yes,
medications.
yeah. So basically, throughout this song, you hear how she reacts to all of these combinations of, antidepressants, mood stabilizers, antipsychotics. They don't name them by chance, but they go through the litany of effects, side effects. And the one thing I hate about this song, Josh, because, this one isn't a musical, but One Flew Over the Cuckoo's Nest, right? It paints psychiatry and mental health professionals in such a bad light of like, oh, we're just, experimenting and we don't have any solutions. And in the end, the woman, I think has a final line in there of like, I don't feel like myself. In fact, I don't feel anything. And you hear the psychopharmacologist say, patient stable. And like, that's not
Well,
no.
for the 1950s, that was,
I guess so, but this was 2008, so I know they're throwing back, but
so
it
you
was
have
a little heartbreaking.
caregiver fatigue, you have patients being confused about medications, frequent adjustments. I mean, separate from the mental health issues about which this is dedicated, there's a medical musical right there that could relate to almost any condition.
Yeah, absolutely.
Then, of course, if we go with my favorite, it's just a quick aside in Guys and Dolls, a
What?
1950s musical. Uh,
I thought I knew everything about Guys and Dolls. Tell me.
so, for those of you not familiar, it's about a gambler who falls for a woman on the right side of the tracks and their love story. Now,
You
there
mean an
is.
Uptown Girl?
she's she's been living in a downtown world. But there's a subplot with two other couples, one of who desperately wants to get married, and she has a song called Adelaide's Lament. Very, very unique voice, which I will give you a brief sample of.
Says here, the average unmarried female, basically insecure, due to some long frustration, may react with psychosomatic symptoms difficult to endure, affecting the upper respiratory tract. In other words, just from waiting around for that plain little band of gold, a person could develop a cold.
So she talks about stress-induced immunocompromise and basically stressing yourself to the point of being sick. Another pretty common one. I know that doesn't sound like anything particularly impressive, but my favorite line in it is, "You can spray her wherever you figure the streptococci lurk. You can give her a shot for whatever she's got, but it just won't work. If she's tired of getting the fisheye from the hotel clerk, a poison can develop a cold." And just kudos for working streptococci into a Broadway lyric.
This is still a mental health. I mean, she's basically describing somatic disease, right? She called it out and said, "Hey, this is somatic."
Well, it's a little bit, but I will say that, we had to go back and forth in medical science to fully understand this. But now it's fairly clear that mental and emotional distress, depression especially, does also depress, so to speak, the more vulnerable to, communicable diseases.
I'll give you a perfect example of a non-communicable disease, Takotsubo cardiomyopathy, or stress-induced cardiomyopathy. Bad enough stress can literally cause a heart attack.
Okay, this is the saddest story. Yes, absolutely true. And they called it, well, it's a heart attack. I took care of someone who performed CPR on their spouse of decades and decades, and that person had some chest discomfort. And we actually did EKG. She had abnormal EKGs and abnormal cardiac enzymes that indicated myocardial infarction.
Mm-hmm.
But then we cathed that person and clean arteries. And this was just from...
Just by chance, during imaging, like the echocardiogram. So Takotsubo, we've spoken about it before. Takotsubo, I believe, was octopus box, Josh, or octopus trap. Do you remember if the heart looked like that? Did it have that weird shape to it, Ward?
So the echo will be abnormal, but it's a transient or a temporary condition. It actually reverses itself after that spell is over.
Well, with therapy. Yeah, exactly. Yeah. Gotcha.
But what I'm getting at is, okay, but this woman, I feel like some of these old-timey musicals do make me cringe a little bit. This character is a little bit being written off as a anxious, somatic person who just gets all these symptoms, right? Because if you give her a shot for whatever she's got, it won't work.
Which is a perfect example of something like, say, an anxiety disorder or a fibromyalgia. So, as you said, somatic-based symptoms. But she's doing her research. She's got medical books and WebMD of the 1940s in front of her. So
a lot of these, I think the dramatic tension a lot of times does come from anxiety, and you feel that character's anxiety, and you can relate to it. A lot of the dramatic tension from these older musicals come from conditions that are, I don't know, that we have a different point of view and the different way of looking at, like Nymphomania that you alluded to in a previous musical.
Mm-hmm.
That's not really. I mean, that's viewed at very differently.
Well,
nowadays.
let's look at a different front of stage. Ward, you're a fairly regular performer in an improv group, correct?
Mm-hmm.
So, what sort of medical issues, if any, come up during your performances?
Live theater in the last 3 years, can you guess what's been a big issue?
Knee problems from all those standing ovations.
Yes, in my case. Thank you, Josh. But COVID. I mean, COVID has
Oh,
been
wow.
the biggest
Hey,
issue in.
Dr. Ward just yes-anded you, and I love that.
That's right. So COVID has been it is the elephant in the room in the last few years. Performers when the pandemic first took a little dip, were performing on stage with plastic plastic sheaths between them and the audience. Some of them were wearing masks, which in a live performance where you have to look at people's facial expressions is incredibly difficult. Even to this day, I think there was a recent article about an actress who chose to wear a mask to the one of the awards, Academy Awards, or one of the Screen Actor Guild Awards, and she caught some flack. And she said, "You know what? This is not a political statement because if I test positive for COVID, I'm out of work I'm like off the site for a good 10 days."
Yeah, absolutely. No.
And in a theater, in an enclosed space where people are enunciating and being big, loud, and funny. Oh my gosh, that COVID is flying out. And
Mhm.
yeah, it spreads like wildfire.
So let's talk then a little bit about how COVID has worked its way into the theater, because it has. And there's actually a firm now that addresses this specific problem called infectious economics.
Oh.
Infectious
Oh,
economics.
wait. Economics, though?
Yes, yes.
Okay.
Founded by Blythe Adamson, an infectious disease epidemiologist and economist.
Oh, okay.
It's a firm helping Broadway productions to build COVID-19 protocols and infectious protocols into their workday. So during the active pandemic, when Broadway was just starting to reopen, some of the things they did included they would collect around 60 samples for daily testing and then pool together small parts of each actor. They would pair them off into groups of 20 on the saliva samples and conduct one test on each of the three pools. Three tests, not 60. So
Okay.
they'd collect 60 samples but only do three tests. If no pool is positive, everyone is clear. If one pool is positive, only the 20 samples in that pool are individually tested until the positive sample is found. Then you do contact tracing and essentially eject that person or put them on the backbench. Economics meets epidemiology.
All
Oh, that's
right.
wonderful.
Yeah.
I can tell you, COVID from personal experience that COVID is incredibly effective in this performance space. I've seen entire performance ensembles wiped out for 2-3 weeks because of COVID.
Yeah. It's any place where you have gatherings like this. So, there was a lot of pushback for this, but religious services, right? Where someone is up there sometimes shouting and talking and several people singing together in a crowd, which will aerosolize everything. And then, yes, theater, especially if you
Screaming.
have any kind of participatory theater where or comedy. You have a lot of people laughing and, spewing particles into the air. And then, the next tier from those were things like, weddings and get togethers and things like that. But yeah, these were all, I don't know if you guys remember in the height of the pandemic where we had these kind of red zones, yellow zones, green zones in terms of what represented risk, but I believe
And
theaters was high
And
up
that
there.
risk is now assessed by a new COVID safety manager position. And that person
Mm,
has to track who's in which room, for how long, who's submitted a saliva sample for testing, and which tests have come back, which goes into a report that looks like a daily stage manager's report on how the show is going, but focused solely on COVID,
oh,
uh,
cool.
as well as recommendations for protocols to even costuming, stagehands and costuming like wig departments. So, a couple examples. For musicians in the orchestra, the wind instruments have to remove their mask to do their job, and forceful breathing could create clouds of virus in the air. So, like
Mhm.
a super spreading saxophone.
Yeah.
Oh no.
Yeah, flute, because I'm a flutist. It's the air doesn't even have the chance to go through the instrument, and so for particles to actually cling to the side of the instrument, it's blowing straight out. So
Whereas other instruments like guitars, drum, or keyboard have a much lower risk of transmitting because those people can stay masked. So, suggestions including portable HEPA filters if space for musicians is poorly ventilated and they can't wear masks. Of
Mhm.
course, frequent hand washing. And I liked explore adding filters to the instruments, like covering the opening of a trombone. Womp womp.
That's a womp womp.
Yeah, it's possible. You have to make a compromise between the quality of the sound that you're getting out and the safety of the people. And this is why in some of these cases you just have to say, okay, well, production shut down.
Well, here's where the economics of it come in. I'm going to give you two a choice, and you tell me. And there's no wrong answer here. Pretend you have a $30,000 budget to spend on COVID prevention for an upcoming theater production. It's going to run 12 weeks, 8 shows a week. How are you going to use the money? So, choice A, you can hire staff to check the temperatures of audience at arrival with fun little temperature guns, do deep cleaning of theater surfaces after each show, and
Okay.
I can give you the cost breakdown of that, which will be, let's see, about 4 people to do it at $20 an hour, 4 hours a show, 8 shows a week, 12. That's about $30,000. Or choice B, you can upgrade your HVAC filters, purchase air filter scrubbers for the least ventilated and most crowded backstage areas and bathrooms, then get some cheap box fans near open windows and doors to bring in more fresh air. And that'll be a massive outlay for the HVAC filters, but the cheap fans offset it, and that costs about 29,500. So roughly the same cost. What do you do? Do you hire additional staff, or do you upgrade just the areas of theater most at risk?
Hmm.
I don't think choice A it does much because remember back in the height of the pandemic, we were using temperature guns on everyone,
Yeah.
Hmm.
and sometimes I got readings that were not compatible with life. I was like, oh my god, this person should be dead.
Yeah, this is a bugaboo that I definitely have, and it's going to put a lot of people who's listening off. But those infrared guns are useless. That was theater. That was security theater using those things because it's
Actors in
yeah.
a theater?
It's it's reading surface temperature, and that has nothing to do with core temperature. You will maybe find people who have a blazing fever, but more than likely you're going to get misreadings that are too high if they just came out of the sun, or way too cold if it's freezing outside. So that's why I really don't like choice A. But the other reason I really like choice B is we know that the preventative measures of masking, distancing, and ventilation prevent the vast majority of cases. And it worked in schools. We have good data from that now, and I'm pretty sure it would work in a space like this too. I'm guessing, Josh, this is still a time where everybody would still be keeping their mask on, right? During this time.
Oh, several theaters made these upgrades during the pandemic. So now, as people are no longer masked, you still have air scrubbers and filters in place.
Right. So, I mean, it's still good, but I mean, masking along with this is probably great. The only thing, it's not an economic question, but I don't know if the noise, because has anybody been in, a true HEPA filtered room? Like these are not quiet machines. So that's the only thing. But Yeah, ventilation, and then of course the regular stuff of masking, and then limiting the number of people who can come in,
I'm
so that
so
they can space
glad
out.
that you both chose choice
Yeah.
B because there is no wrong answer as a health economist, but
Sure.
as a physician, there is a
Yes.
clear correct answer
Yeah.
to decrease
Well,
the risk of infection.
Yeah.
also in the theater, just COVID aside, upgrading HVAC always a good idea. I can tell you,
Yes.
if you've
Yeah.
ever sat in one of those small black
Dusty.
box theaters,
Yeah.
no
Yeah.
windows, and if you don't have AC, if you live in a hot climate, it gets steamy real fast. You pack a theater, you close those doors, and because of soundproofing, also traps heat inside. And then you have
Yeah.
stage lights that, if they're not upgraded to LED, those are like halogen lights. That theater gets steamy. And I remember I was in one theater one time in San Francisco. The only air intake is coming from an alley um, down the street.
As Ward and Santosh have mentioned, with a complex theatrical production, there's numerous hazards separate from what may be sung about, separate from just being enclosed. A falling backdrop, which is also in a theater. If you want to get really meta, that's what happens in Phantom of the Opera.
Oh, okay. Yeah, yeah. You've got to.
Falling backdrop is a theater injury, which happened for real during the 2009 Tony Awards for Rock of Ages when another falling backdrop hit Bret Michaels on the head. That's
No.
not
Oh,
to
jeez.
mention that's not to mention rigging and flying hazards, as we've seen in numerous CSI shows whenever there's a theater episode.
Yeah.
Uh, and we can start talking about what are some of the kinds of injuries that specific theater people may get, whether they be front of stage like dancers or back like carpenters. And there have been actual studies. One of my favorites. In 1990, the National Institute for Occupational Safety and Health, NIOSH,
Mhm.
received a request from the Actors Equity Association to investigate health effects associated with theatrical smoke. So you have fog machines on
Right.
Broadway.
Yeah, yeah.
And they want to know what's our risk of things like asthma, Legionnaire's disease. So NIOSH took air samples, as well as administering a question, at 4 different ongoing Broadway productions using theatrical smoke: Les Mis, Miss Saigon, Phantom of the Opera, and Grand Hotel, to look for measurable respiratory effects among performers.
Uh-huh.
And the study found that there's no evidence that it's a cause of any sort of asthma, although it can, if not well maintained, be a risk for infectious disease. There's a
Sure.
whole report about it.
I mean, if they do 3 shows a night, 5 nights a week, that's a lot of smoke. I think it's reasonable to look into it and see if it does cause any issues. I'm glad that it doesn't.
Yeah, I think that's a very fair question.
Then you look at the different kinds of performers, and they're subject to a lot of, well, sports injuries. It's a different kind of act. So it's dystonia in different musicians, which is a failure of relaxation of an opposing muscle group. So you can have difficulty drawing a bow across a string slowly and smoothly, which is known as purling. Or French horn players get problems of lip control, which is cracking of the note. So that can affect their actual performance. For singers, as if you get any kind of infection that affects your vocal cords or a
Mhm.
neuromuscular disease, you lose your vibrato or
Well,
the
vocal cord
regularity.
dysfunctions can go beyond just not singing your best or sounding your best. They can affect the way you eat, the way you swallow, and the way things go down the tube.
One of the most health conscious groups of performers are actually dancers. And on Broadway currently, and for the last, I think, 30 or 40 years, the union puts in the contract if there's dancing in the show, there has to be a physical therapist. Not like dancing,
Oh,
but available
yeah.
for the dancers.
No, that makes a ton of sense. So just like in any kind of sports ball event, you have to have trainers available on both sides, as well as, well, in those cases, there are also doctors kind of ready to go in case there are acute injuries. I'm guessing you don't need that for theater, but the parallel for having a physical therapist or a trainer on board, hopefully with staff, like massage therapists and stuff.
Oh, in
Not on
fact,
staff
Okay.
necessarily, but uh, there are a group, at least in New York, of physicians who volunteer as performance medics along with EMTs. They
Oh,
do not
gee.
attend every performance, but they are essentially on call to the theater if something happens to cast, crew, or audience. But when you're looking at a lot of things that stage managers have to work with, remember it's $30,000 just to replace the HEPA filters, and a
Yeah.
Broadway show may not have a lot of budget left after that. So, and now the union has to require a physical therapist. So let's look at the injuries. The majority of dance injuries tend to be from the knee down if you're dealing with ballet or modern dance. But if you have heavy headpieces or wigs, like in Hairspray, that puts torque on the neck. Shows with puppets, like Avenue Q, they have to do repeated things with their hands, and doing that many, you can end up with wrist sprains or, in some cases, even dislocated if a turn is taken too fast during dancing with puppets.
Wow.
On
Yeah.
Bring in the Noise, Bring in the Funk, you have to mic the shoes because people were stomping so hard they were straining and breaking their ankles.
Ooh.
oh, in fact, gentlemen, you know there is a fracture called the dancer's fracture.
Oh, I don't think I've heard of that one.
Um, the dancer's fracture is a avulsion fracture of the fifth metatarsal. It's a foot fracture, precisely because, like Dr. Josh alluded to, modern dance and ballet, you are tiptoeing sometimes on one foot, creating an incredible amount of torque on that one little weakest link in the chain, and it can avulse that bone. Most of
Wow.
the time, it's it's housewives and me tripping and off a curb causing that. But I tell my patients, hey, you know what, my dear, you have a dancer's fracture.
Okay, okay. I'm sure there are other mechanisms for it, but that's the classical one, Ward.
Correct. It's a
Got
ballet.
it, got
It's a
it, got
ballet
it.
injury. Yeah.
I have actually, in when I was doing pediatrics and taking care of kids occasionally who were like phenoms in music and this kind of a thing, overuse injuries a lot. So a person would lose their voice, a kid would lose their voice because they didn't do vocal rest. Especially if a kid was playing an instrument wrong, meaning like they were contorting their body the wrong way to try to play, and they were never taught properly, they could really cause some bad soreness, in a wrist, elbow, shoulder, or something like that, and cause some bad overuse injuries.
There is a lot of different kinds of injuries you can get, and clearly, medicine is much more integrated into the theater than you might have thought originally. And we're really just talking about musical theater and Broadway. Being crew in a theater is a lot like being on a construction site. You have
Yeah.
electrical injuries, solvents, painting, falling wood, and of course, the curse of phantoms.
Yeah, yeah.
Ward, have you seen any performance injuries during your tenure as either an ER physician or as a performer? Have you seen any audience members get injured while you were performing? And what does that do to the show? Does the show go on?
Well, audience member. So you're not supposed to touch audience members in most shows. The fourth wall is not strictly enforced, but in experimental theater, you don't. But yeah, I've actually, as a physician, I've taken care of stagehands, and I took care of I won't say the name of the performance group, but a circus act that does some pretty impressive circus work, and some once in a while they fall, and the poor performer still had a big smile painted on his face when he
Oh,
saw me. Poor
yikes.
guy.
Oh no,
I was like, oh, is he smiling? No, he's not. He's
oh
crying on the inside.
no. Oh, that makes me kind of sad though. They're actually, when you do blinking or strobing lights, you cannot broadcast them at certain frequencies because our brains inside of a particular range of blinking frequency are very vulnerable, even if you have no epilepsy at all, to actually going into a seizure. So, but even working outside of those frequencies, if a person does have epilepsy, then they're more vulnerable to getting set off from one of those. And usually there's a warning or something, right, in the program or something like that.
But the show will go on. The show will go on. Most shows go
Yeah.
on, for better or worse. But fortunately, most of the time that doesn't happen, and the drama is on stage, and
Yeah.
I prefer it that way. I try not to tell people that I'm in the medical profession when I'm anywhere near the performance space, because I want to
I'm
focus
just
on.
imagining, is there a doctor in the house? And Ward just sighs and steps out of character.
Why is
And
Mufasa giving CPR?
The lion's trying to eat that man.
yeah.
No, it's
No.
just CPR.
Mouth to mouth.
Yeah.
Well, Jimmy.
The lion.
So, as we talked about Medicine the musical, if you were making a medical musical, what is the title of one of the songs? You don't have to sing it, although you certainly can. But what is the title of one of the songs in your show?
I googled it. Would be one of those antagonist songs.
Oh, the
Ugh.
like
all,
WebMD.
all minor chords and singing in rasp.
A similar number in my head, Ward, but rather than I Googled it, I was calling it non-compliance.
Oh no!
Tragedy.
Oh, you guys are talking about very kind of dark kind of
Well,
stuff.
that's in the middle. One of the opening show songs would be "Help Me, Doctor." Or no. One of the opening show songs would be "Time to Breathe."
Oh, okay, gotcha. That sounds good. I like that. Yeah. I kind of like the pun. Like, get that infection out of here. I don't know. I'm trying to weave the in and the
That's
out.
a punchline, Santhosh.
Yeah, that's
Yeah.
Oh no, but that would be
Oh, yeah.
that could be a good that could be a good like a catchphrase in that song.
Yeah. Yeah.
Get that infection out of here. Get that infection out of here.
Yeah.
I think Lin-Manuel Miranda has written enough musicals that okay.
Oh man, I would love for Lin-Manuel Miranda to get a little bit into the
Actually, he would be good for this.
yeah,
honestly,
the musical, sure, the medical
The
musical
respirator
space.
does the beep, the rhythmic beep, beep,
Yeah.
beep. Drip, drip, drip.
Yeah.
And the monitors are going drip, 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 and the
Yeah.
infections are beeping, and they have C. diff. I'm sick of all the various injections. Man, I just wish they'd get out with this infection.
Oh, damn!
Drop the beat. Well, perhaps, gentlemen, one of those days we'll do a podcast in musical form.
We did. Season 3.
Oh, we did. Alzheimer is settling in for the Ward. Did we? Really?
We had a rap battle.
Yeah.
Oh, that's right. We did. But I'm talking about
You were there. So,
it was
listening
good.
audience, what's the name of the medical Broadway song you'd like to see? And we'll try. We'll see if in a future episode we can get a couple of them out there. But that's it for this week. As always, we love to hear your comments, questions, and feedback. If you'd like to support us spiritually, emotionally, or financially, links to do that are in the show notes, along with links for further reading. If you like this, tell people about it. That's how we make more. The show is produced by me with a lot of help from Dr. Santhosh, Ward, and friends. Our theme music is composed by Rachel Leisure.
Oh, wait. Fever Mountain Penicillin.
And until next time, keep a song in your heart, soap on your hands, a shot in your arm, then put a spin on the globe, and when you found somewhere that looks interesting, happy travels.
Fly safe.
Yay, happy travels.